I mean, it's got P-rays, it's a sinus arrhythmia. It's very strange.
Yeah, that's what I'm saying. But see, I think it's because I gave him the atropine and it's starting not to wear off.
As of this date, in this hospital alone, we've seen 432 cases of flu. The year prior to that was in the 40s, so in the mid-40s. So we've seen a significant number of cases as well as a significant number of admissions, over 40 admissions as of date for flu-related illness.
I don't know.
Okay, so
I don't know.
it's kind of every day.
It was feeling bad. Going down the road feeling bad, you know what I mean?
I do. So when did you start to first having symptoms?
Oh, must have been 2 weeks ago.
About 2 weeks ago.
Yeah.
This is real. Yep. And I think one thing that people can do is really pay attention to, what the news is saying about presentation for flu, as well as going to the CDC website and learning about it, when to go to the hospital, when to call your doctor. That's not always an easy answer, but truthfully, most patients we recommend to, if they're healthy and young and don't have a lot of medical problems, to try to stay home, try to avoid contact with other people except for necessary outings to prevent other people getting exposed to that.
Well, I couldn't. The worst is that the legs were weak, and the legs were weaker, and my wife probably had.
Well, I will say this, it's been the busiest I remember for a long time. A dramatic impact on us from the patients that are arriving via the front door or via ambulance. A significant number of elderly patients that are very weak, that may not even have all the typical flu symptoms, but they just can't even get out of bed, they're so weak. So we are seeing that, and it's impacting us from a standpoint of the amount of beds. So in fact, using hall beds, any available space that we have to try to see patients, and including the typical things that we have to emergently take care of, like heart attacks and strokes. And so we've had to accommodate that not only by changing our shift coverage if needed. Hospital staff are staying over or coming in early if needed, and each one of our hospitals has actually been significantly impacted this year by the amount of flu that's been presenting.
So he has an underlying rhythm of how big was he wasn't when he came? Is that what that is now?
It's the elderly patients and the real young patients, or patients that have multiple medical problems. Those are the complicated ones, and that we expect potentially could have worsening presentations or other complications related to the influenza virus.
Is it somebody that's allowed?
Yeah, 46. Yeah, they asked me if I'd go get him a sandwich and something to drink. They're waiting for a room.
So my suspicion is, it could go into March, but on the other hand, I'm hoping that the sheer numbers that we've seen so far are going to start to peter off.
Yeah, they can have that. That's fine.
Okay.